Hi, I am Dr. Elankumaran, corneal transplant, refractive and cataract surgeon. Currently, I am the medical director at Navashakti Netralaya, Outer Ring Road, HBR layout, near Nagavara flyover, Bangalore. Unilateral headache or one-sided headache associated with eye pain can be because of various reasons. They can be commonly classified into eye-related causes, neurological causes or nerve or brain-related causes, or other causes which include like sinusitis. They can also be because of tension-related headache or cluster headaches, or it could be a simple migraine. Also, let us remember that simple cough itself can cause headaches. Continuous coughing can cause headaches. So, it is important to find out the cause here and treat accordingly. If it is an eye-related cause, it's easier to treat, but more common are the tension type of headaches, which is related to stress or sleeplessness, or a simple migraine which can be associated with one-sided or unilateral headache and one-side eye pain. It is important to get yourself checked by an ophthalmologist or an eye surgeon, and if necessary by a physician or a neurologist, depending on what is the outcome of the ophthalmic examination.